Hi, everybody. Welcome to the 35th EACTS annual meeting, and also welcome to this second Medtronic practical tutorial focused on autotransfusion and on the AutoLog IQ autotransfusion system. My name is Jesse Wouters, and I'm Medtronic's Training and Education Manager for Western Europe. And to be more precise, I'm responsible for the Extracorporeal Therapies Division. Together with my dear colleague, Benoit Jeanette, who is sitting here next to me, and Benoit is our Blood Management Product Manager, we are going to present on autotransfusion and on the AutoLog IQ autotransfusion system. And last but not least, we're going to take the opportunity to introduce you to an innovative product training, and we're going to do that by using virtual technology. Before we dive into today's agenda, I want to take the time to briefly share the objectives of this practical tutorial. So Benoit and myself, we want to address the importance of autotransfusion not only inside but also outside cardiac surgery. We want to help you understand better why the AutoLog IQ system is such an innovative technology. And we're going to do that by presenting the key advantages of this system. And last but not least, as mentioned before, we're going to introduce you to an innovative product training, and we're going to do that by sharing a virtual experience with all of you. So this is the agenda that Benoit and myself prepared for you today. And let's immediately ask ourselves, why is blood management now so important in cardiac surgery? Well, we know that bleeding is still a significant complication in cardiac surgery. In this publication from Alatar and others, they found that up to 15% of open cardiac surgery patients are experiencing still major intra or post-operative bleeding. And well, let me take my laser pointer now. In this figure, you see a comparison of all different cardiac surgery surgeries. And they're all exposed to bleeding complication. But bleeding is the highest seen in the aortic procedures, which is pretty logic, right? So bleeding complications, they're also associated with worse clinical outcomes, including a higher risk of infection, a higher risk of ischemic events due to hyperperfusion, but also a higher risk of in-hospital stay and mortality. And last but not least, transfusion-related adverse events. So in this figure, Alatar and others, they did their research, and they found that the length of stay in ICU and also the length of in-hospital stay was extended with 2 up to 3 days compared to non-bleeding patients. Additionally, bleeding is also an important driver of allogenic blood product utilization. And in England and other Western countries, it was reported that 10 up to 20% of the total blood supply is being used especially for cardiac surgery patients, which is a pretty high amount. And when we use allogenic blood products, we are basically exposing our cardiac surgery patients to an increased risk of potential transfusion-related adverse events. And in this slide, and to be more precise, in this table, you see the complete list of all possible adverse events. And you can even divide them in 4 different groups. But we're not going to focus in detail on them because this is not the purpose of this practical tutorial, but this slide is just to show you that using blood products comes together with the potential risk of many transfusion-related adverse events. So we know that bleeding is still a significant complication in cardiac surgery, but also important to mention is that every hospital manages the patient's blood in a different way. Traditionally, shed blood, which is also known as cardiotomy suction blood, was aspirated back into the heart-lung machine via a cardiotomy sucker. So in this way, this shed blood mixes immediately again with venous drainage blood that runs through the heart-lung machine. Now, over time, it was discovered that this shed blood is highly activated and can be associated with also a bunch of of adverse events, which you can see here listed up. Okay. Well, if we would now collect this shed blood apart from the systemic blood flow that runs through the heart-lung machine, then it becomes possible to handle this blood separately before returning it back into our patients. And in this way, it might be possible to reduce the pathological activation caused by shed blood. What I've just explained is supported by different guidelines. For example, here we focus on the EACTS, EACTA, and EBCP guidelines, which were published in 2019. And it was seen that both discarding shed blood or processing this shed blood before reinfusing it back into our patient, both of them were seen as a class of recommendation 2A with a level of evidence B. Now, how can we process the shed blood? Well, for example, we can use an autotransfusion device for that. And this is really the focus of this practical tutorial. Now, let's go over the basics of autotransfusion very, very briefly, okay? Good, so what is autotransfusion? Well, it is the collection of blood or blood products derived from a patient's own circulation, which is collected or shed from a wound or a body cavity prior to, during, or following surgery for reinfusing it later back into our patient. You see that autotransfusion has many different indications, which we're not going to focus into detail. But very important to state is that autotransfusion is not only used anymore in cardiac surgery. Also, many other divisions are starting to use autotransfusion nowadays more often because everybody is getting aware of how important autotransfusion technologies are. So using autotransfusion technologies comes together with potential benefits. For example, let's focus on the clinical benefits. When we would use autotransfusion, we would reduce transmission of bloodborne diseases, we could lower the risk of transfusion reactions, and we could even help address the very important blood shortages. Besides clinical benefits, using autotransfusion technologies also has some potential financial benefits. For example, we can reduce the cost we can reduce the use of costly allogenic blood products. We can help reduce the costs of transfusion-related reactions, and we can also reduce costs associated with clerical errors. Now, what are we all trying to do? And this is also the goal of autotransfusion. We always want to return the highest quantity and quality of blood to patients with the least amount of waste and preferably as quickly as possible to minimize or even try to eliminate any blood transfusions. So what is the best way to achieve this? Well, my colleague Benoit Jeanette will guide you through it and will introduce you to the AutoLog IQ autotransfusion system. So with that said, Benoit, I'm happy to pass the microphone over to you so you can get us introduced to the AutoLog IQ autotransfusion system.
So thank you very much, Jesse, and hello to everyone. Let's start with the basics. The AutoLog IQ system performs blood cell salvage like any other autotransfusion device available on the market. However, only modern technology allows to return high quality of washed red blood cells with only one ball size and adaptive blood processing programs. It's simply genius. What's the best way to achieve this? To answer that, you need to take a look at what goes on inside the autotransfusion device and to consider the two most important features that comprise an autotransfusion device. Like the heart and the brain are the two most important organs in the body, the ball design and the management of the blood processing are decisive to get the best washout performance and quality of packed red blood cells. Inside the autotransfusion device, the ball is the heart of the devices and all the blood is proceed, the masterpiece of the intelligence of the software. Learning the history of the ball design, it's also crucial to better understand the difference between the technology embarked into the autotransfusion devices, the cream separators in the ancestor of the ball design and blood processing. But if the Baylor balls from the name of the conceptor, Mr. Baylor, was developed during the 60s, the first ball released on the market was the Latam ball from Dr. Jacques Latam in 1971. From this time, the Latam ball remained unchanged or improved. All manufacturers of the autotransfusion device use the Latam ball, included at Medtronic with the electromedic autotransfusion devices family and the Sequestra. However, in 1996, Medtronic decided not to continue to use the Latam ball because already perceived as an old technology, and launched it as a new ball design, the IntelliPad ball, and more recently, the Autolog IQ. To perform a dynamic blood cell salvage was now possible. We will see later how to achieve this. There are three categorically different methods of blood processing: passive cell salvage, which use the Latam ball, continuous cell salvage, and dynamic cell salvage. There are three things that distinguishes the dynamic cell salvage. First, there is the IntelliPad ball. One ball size works for most procedures. That may seem counterintuitive, but it has been designed to work that way very effectively. Nor is it Iris where it's getting interesting. The AutoLog IQ uses an adaptive two-stage fill process to get high hematocrit with less waste. It's a little bit like filling a soda glass, putting all at once, and you know what's happened. With the adaptive two-stage fill, the system does an initial fill. It pauses it briefly to compact the red blood cell. Then it adjusts the second fill speed. Slower for low hematocrit, faster for high. That made the way to keep more red blood cell and to lose less into the waste bag. The third key feature is a pulse wash. See these little indentations. They are a part of the IntelliPad ball design. The pulse wash combined with the indentation with servo control on each pulse adapted to the saline penetration through the red blood cell layers effectively remove all of this contaminant, the plasma-free hemoglobin, residual anticoagulation agents, platelet, white cell, proteins, and is more efficient versus a conventional steady flow. Indentation disrupts the red blood cell pack during the wash, which optimizes the saline penetration for an effective wash cycle. The pulse wash makes the wash process more efficient by adjusting the saline volume depending on the characteristics of the red blood cell pack. Each pulse volume is designed to minimize red blood cell spillage and to keep more red blood cell into the ball. All this automatically. No need to make some micro adjustment during the blood cell salvage procedures. With dynamic cell salvage, you are consistently delivering high hematocrit and quality packet red blood cells for the patient with just one prolapse. You might think that its intelligent pre-calibrating process will be slower. Not so. For your standard case, you will proceed high quality blood for return in approximately 3 minutes. The AutoLog IQ proceed time is still more faster than when we fast wash or emergency wash is selected. All autotransfusion devices available on the market can perform a cell salvage and to return one pack of red blood cell at the completion of the blood process. However, all autotransfusion devices cannot achieve the same level of washout performance, fast with simple setup and ease to use. Nowadays, a modern autotransfusion device should perform a blood cell salvage from an easy way with less feature to comprise the devices, better washout performance, and should meet the goal of the autotransfusions as Jesse pointed a few slides ago. It's a high priority. Now, let me give the stage again to my colleague, Josie. In the second part, Jesse will show you how virtual training program can help the end users. Jesse, the floor is yours.
So thank you very much, Benoit, for introducing all of us to the very innovative AutoLog IQ Autotransfusion system. Now let's focus in the final chapter of this practical tutorial on an innovative product training that was created by us and recently launched. So the next slide is also a slide that I have presented already in the first practical tutorial, which was focused on the quantum meter cooler. But the message is pretty much exactly the same. So as you know, we're still dealing with the ongoing COVID-19 pandemic, right? So this makes trainings that you see here in this picture, trainings that were based on a presence in a clinical environment like classes and wet labs and congresses and local events and what have you. Well, trainings like these are currently still in quite some countries prohibited, and this will probably last for a while. So for now, I think it's fair, and I use this picture a lot in a lot of my presentations. I think it's fair to state that trainings like these are still quite mission impossible, but we're heading in the right direction, and hopefully on-site trainings will be mission possible again. So the result of this ongoing coronavirus pandemic was that many training and education programs, and probably not only within Medtronic, but also within other companies as well, they needed an emergent transition from face-to-face to online learning, which comes together with a lot of challenges. Within Medtronic, we explored a bunch of innovative technologies available, and we started working with virtual reality. So what we did is we created the European Experience Center, which is located in the Netherlands. We created this European Experience Center in virtual reality. So what we did is we created 4 virtual rooms. For example, and let me take my laser pointer out again. Here you see the entrance hall of the ECK. You can see the conference room where we would normally present all our presentations. You can see 2 pictures from within the wet lab where we would do all the experiments on our flow station. We have built an intensive care unit. This one is still under construction, but we will be able to train you in the near future on some of our ECLS solutions. But the focus of this practical tutorial lays in the virtual cardiac operation theater. And to be more precise, we're going to focus on the VR AutoLog IQ training. So before we go on and really show you the VR product training and how it looks like, it is important to mention that Medtronic does not believe that using innovative technologies such as virtual reality will replace any on-site hands-on trainings in the future. No, within Medtronic, we see it in a broader way, and we call it the 3 steps approach. We see such trainings, such VR product trainings, as a part or a mandatory part in a complete product training. So for example, if you have a customer that is interested in the AutoLog IQ system, we would first send out a special suitcase with the VR equipment in. Well, the customer himself can put the headset on and follow the completely individual self-trained module. And well, he or she can do that in their own hospital facility. How does it work? Well, the VR product training will lead you through many different steps like introduction to the product and to the therapy, how to set up the product, troubleshooting, scenarios, and many more. And after completing this VR product training, you are ready then for step 2. And step 2 is then the in-hospital hands-on training, which will go much faster and much easier because thanks to the VR introduction to the product, you already exactly know what to do. And then the last step in the complete product training is then providing clinical support during a real case. So I know that this is a lot of information that you need to process, but let's make it visible for you so you exactly know how such a VR product training looks like, okay? So in the camera view, you see that I'm putting the headset on and taking the controllers in my hands. In the meanwhile, you also see a small robot, which is Robot Eve, and she tells me exactly what to do. So there is audio and I have the possibility to read. If I complete something successfully, Robot Eve brings me to the next step. Or I could open the menu and choose the step where I would like to be trained on. So for example, here I want to discover what is in the Medtronic card box package. So I'm opening the package and then I will remove the collection, the box with the collection reservoir. So I'm placing it on the table here. I'm opening the package and then I have a view on the collection reservoir. In this way, I will also learn about the different specifications. Now let's transport you all to the VR operation theater. And here we will have the possibility to train ourselves on technical features, but also on how to use the AutoLog IQ Autotransfusion system, how to set everything up, and how to use disposables in their most effective and correct way. So for example, here I'm replacing the bracket holder. Now I will show you how to power on the AutoLog IQ Autotransfusion system and how to use the touchscreen. So I'm pushing the power button here. The screen is maybe a little bit too big in this view, so I'm also able to make it bigger. And now I can play with my settings. So for example, I can increase or decrease my vacuum settings. I can scroll through the data. In the setting tab, I can play with the volume of my audio. I can play with my screen brightness. So everything is so in detail, and everything is fully identical on how you would use it on a real AutoLog IQ system. This is also to show how in detail we have created this VR product training. So here I'm going to take the heparin and I'm going to take my syringe and aspirate the bolus that I need for putting in my saline solution. So again, we've done our work and everything is so much in detail. So after this training, you would exactly know how to use the AutoLog IQ Autotransfusion system. Let's place the syringe now back on the table and do something else. So now we're going to focus a little bit more in detail on the suction and the anticoagulation line. So I'm going to take that from the table and then I'm going to place it on the AutoLog IQ system. And then I'm going to disconnect the blue cap of the collection reservoir. I'm going to place that blue cap in the tray. And then I'm going to connect the suction anticoagulation line to the inlet of the collection reservoir. Good. All right, so the last thing that I want to show you is let's install the wash kit, for example. So here I'm taking out the waste bag. I will position the waste bag onto the waste bag pins. Then what we're going to do is I'm going to pull out the holding bag and mount it on the pole. We need to close the two clamps, the two white clamps, which you see here. And then I'm going to take out the IntelliPod bowl and place this bowl inside the centrifuge chamber. And I'm gonna position the bowl in a way that the waste line is pointing at the waste bag. And in this way, I can then remove the two yellow caps and connect the waste line from the IntelliPod bowl to the waste bag. And you can see that happening as we speak. And then the last thing that I'm going to show you guys is how to install, for example, also the manifold. So here I'm taking the manifold from the table, and then I'm putting the manifold in its correct position. And here you can, for example, see that I'm pulling the single line of the manifold into the air detector. And then I'm gonna pull the pump lever, stretch the pump tubing around the pump, and then I'm gonna release the pump lever again. And then the last thing that I need to do is connect this line also with the IntelliPod bowl, which I'm doing right now. Okay, so this is just a recording that I have created for you guys, so you could see how such a VR product training looks like. If you're here live in Barcelona and you're interested to experience this VR product training by yourself, well, please join us in our meeting room, which is room 112, and you will have the possibility to experience this VR product training. Also, if you're not live here in Barcelona, but interested in doing this VR product training, just connect with your local Medtronic representative, and we'll make sure you're scheduled for experiencing this VR product training focused on the AutoLog IQ. Last but not least, we also have a VIP lounge available in Hotel AC Marriott on the 14th floor. So please join us and we can discuss this training more in detail. I want to thank you for participating in this practical tutorial. And both Benoit and myself, we wish you a nice rest of the day and a nice rest of the EACTS meeting. Thanks again for your attendance. Bye-bye, everybody.